Hey guys, it's Brandon. I'm back with another mental health video. Today, we're going to be talking about medication. So, when I first got diagnosed with bipolar 1 with psychotic features, I was not into the diagnosis. I was adamantly opposed to the fact that I had bipolar. I went to 4 separate psychiatrists. Each one told me I had bipolar, and I just told them that I had ADHD and that I disagreed with their diagnosis. So it wasn't until I was involuntarily committed to the mental hospital that the inpatient psychiatrist convinced me that I possibly might be bipolar. So when I was inpatient in the hospital, they wanted to put me on lithium. And to me, that just sounded like Fred Flintstone was gonna deliver it like barefoot on like a dinosaur car, or like it sounded so old and ancient and archaic. Like, lithium? You're gonna put me on lithium? No. So I was against it. I didn't want to be on lithium. I told him no for a while in the hospital. Then finally I got convinced. I said, well, it worked out so well for Kurt Cobain, why not? I'll just go on lithium. So right now, I'm on 900 milligrams a day of lithium carbonate ER. That's the extended release version of lithium. Lithium is a mood stabilizing drug that works to balance mood, thoughts, and behavior. Lithium is generally prescribed to treat bipolar 1 and major depressive disorder. I started out on 600 milligrams a day, and they bumped me up to 900 milligrams a day. Sounds like a lot. It's only 3 pills. I take 2 at night and 1 in the morning, and I've had little to no side effects from lithium. I gotta say, I'm on a low dose, and so far so good. The next medication I'm on is called Abilify. Abilify is an anti-psychotic drug. Now remember, I'm bipolar with psychotic features. That means that if I'm manic or depressed, I can have hallucinations or delusions, or both, as per my last video, hallucinations versus delusions. So a drug like Abilify, which is an antipsychotic, is going to work to balance my brain chemicals to turn down the hallucinations and delusions. Now, there's no cure for this. Antipsychotic medications are not cures. They just turn down the volume on the hallucinations and delusions to a manageable level. That's my experience, at least. So I was put on Abilify in the hospital for a little while. I was given 5 milligrams, and no, 2.5 milligrams at first, and I tolerated that okay. When they bumped me up to 5 milligrams in the hospital, I noticed my sleep started to get really, really broken. Like every time I would fall asleep, I felt like I would be like ripped out of a REM cycle that was like just about to happen. So I discontinued the Abilify in the hospital, but when I got out of the hospital in January, a little bit of time went by and we decided to add the Abilify again in February. So I'm back on the Abilify, 5 milligrams daily, and Abilify has been working really well to turn down the hallucinations and delusions that come along with my bipolar 1 with psychotic features. It's also used to treat schizophrenia, depression, even Tourette syndrome, and some of the irritability associated with those on the autism spectrum. So, I also took, because I have ADHD, so when I first got to the mental hospital, I was on ADHD stimulant medication. I was drinking over the summer on the stimulant medication. They believe maybe an alcohol-induced psychosis may have kicked in a little bit. It may have triggered my manic episode. They're not really sure. So I discontinued the stimulant medication for my ADHD when I went to the hospital in December. And about 15 days ago, 2 weeks ago, my psychiatrist added in Wellbutrin. So now I'm taking Wellbutrin XL, extended release, and that is used off market to treat ADHD. It's primarily used to treat seasonal affect disorder and major depressive disorder, but it's also used off market for ADHD, and it's treated or prescribed for tobacco cessation. So an interesting thing with Wellbutrin, 15 days ago, I was a tobacco smoker. I was putting a little bit of American Spirit tobacco on my cannabis when I would smoke, and I would do this all day long. I wasn't smoking cigarettes, but I was hooked on nicotine. And I wanted to take the Wellbutrin because I was interested to see if it would help me stop smoking as well. So I decided just to keep going normally as I took the medication. I wasn't going to try anything different or extra. I just wanted to see what it would do to my brain. And I got to say, I don't know what happened, but I haven't smoked in 8 days, cannabis or tobacco. And that just blows my mind. I mean, I'm still using edibles. I take cannabis gummies, it really helps me manage anxiety and stuff like that. But I haven't inhaled a thing in 9 days, 8 days. And that hasn't happened in years and years and years. So salute Wellbutrin. Now, Wellbutrin is a norepinephrine and dopamine reuptake inhibitor. A lot of antidepressants are SSRIs. They're selective serotonin reuptake inhibitors. They work to keep more serotonin in your system. Wellbutrin is an NDRI antidepressant. It works to keep norepinephrine and dopamine in the system longer. So it blocks the reuptake of that so that you have more dopamine and more norepinephrine in your system. So norepinephrine, right? That's like, I think adrenaline, fight or flight, stuff like that. So for some people, and myself included, about 5 or 6 days into my Wellbutrin prescription, I really started to notice a lot of physical anxiety, just physical anxiety symptoms, a lot of mental anxiety, and a little bit of insomnia as a result of just the anxiety. Now, it was manageable, but pretty uncomfortable. I read a lot of people, I went on Reddit, and it seems a lot of people tap out on Wellbutrin and just can't get past the uncomfortable phase. I pushed through, and right around day 8 or 9, I noticed a significant drop in my resting anxiety levels, both physically and mentally. And since then, it's been about baseline for me. So 15 days into Wellbutrin, about 4 or 5 months into Lithium, and I've been on the Abilify since February, and things seem to be going well. So that is my medication cocktail at the time of this video. I'm on Lithium Carbonate, 900 milligrams a day. I'm on Abilify, 5 milligrams daily, and I take Wellbutrin XL, 150 milligrams daily. That is my medication routine. I'm not a doctor. I cannot prescribe nor tell you what you should take or shouldn't take. These are only my experiences designed to help whoever it might help. Again, my name is Brandon, and if you or someone you know is struggling with mental health, please call 988 Suicide Prevention Hotline, and someone will be on the other end if you just need somebody to talk to. They can link you up with services and get you through the day if you're having a rough one. I'm going to do a review video on 988 in the near future, so stick around. Thanks again for watching. Please be sure to like, share, and subscribe. My name is Brandon. Stay well.